I'm Chad Moses, physical therapist with UNC Health, Cary Orthopaedics. In today's patient education series, we're going to be discussing spinal manipulation. The goal is to give you a quick overview of what spinal manipulation is, why we use it, the benefits, and some of the myths and misconceptions that surround it. So what is spinal manipulation? It's a manual technique that's performed by a specially trained therapist that involves a high velocity, low amplitude thrust to a joint within the spine. This can be performed anywhere from the cervical, the thoracic, the lumbar, or even the SI joint. So what's happening within the body after a manipulative technique has been performed? The application of the stimulus, the thrust, is causing impact on the surrounding paraspinal tissues to elicit a neurophysiological response on the body. Within the manipulative technique itself, we have either a localized, a segmental, or a supraspinal, which means it's dealing with the brain, effects on the body's peripheral and central nervous systems. This neurophysiological response has an effect on the ascending and descending inhibitory systems of the central nervous system. It releases the body's natural endorphins and anti-inflammatory agents to help with the healing of the tissues. From a muscular reflexogenic aspect, we are able to reduce muscle tone around the surrounding tissues of that joint. The bottom line is we touch the skin, we touch the brain. Overall, when you simplify the neurophysiological response, the manipulation can be a very effective tool for symptom modification, allowing us to decrease the sensations around the tissues in the joint, reduce muscle tone, decrease pain, and improve the patient's quality and quantity of movement in the area. Although these effects are temporary, this will give us a window of opportunity to get the patient feeling better and moving better so we can introduce an exercise program and build muscle resilience. Myths and misconceptions about spinal manipulation. Manipulation is not a magic bullet. It does not fix or cure anything. It's a tool, a technique, a modality used for symptom modification, just like any of our other treatments in physical therapy, such as Graston, kinesiotaping, dry needling, or massage. It cannot improve your overall health or treat systemic conditions. We are not bone setting. We're not putting joints back into place. We are not correcting positional faults or putting the pelvis or spine back in alignment. It's also impossible to be specific at one joint. Our intent as therapists can be specific, but the reality is we're affecting multiple levels above and below the joint we are targeting. And lastly, you don't have to have a cavitation, a click, or a pop for the technique to be effective. In closing, spinal manipulation is a safe and effective treatment when used appropriately. There needs to be a comprehensive exam of the patient with a screening process to see if they're a good candidate for the treatment. At the end of the day, what provides long-term solutions is patient education, understanding, looking at the biopsychosocial aspects of the treatment, the need to create tissue resilience, and getting the patient into an exercise-specific program. What the patient does off the table is more important than what the patient does on the table. Thanks for watching and enjoy the demonstrations. This is a cervical spine manipulation in the supine position. The manipulation itself is a fast and gentle thrust within a very short and safe distance within the physiological range of that joint. This causes a gentle separation of the articular surface, stretching of the articular tissues, and depressurization of the joint. This results in a release of gaseous substance, creating the click or the pop sound. Oh yeah. Oh, it's ready. Oh yeah.